Okay, so welcome everyone to the last in our Before You Check Out series with the Lawrence Public Library. So this topic today is going to be our lunch and learn about death, but more than a casserole. So finding out things that we can do to help loved ones who are going through the grieving process and learning to adapt and handle this new situation. So we do want to thank everyone who is on our panel, which I'm going to let them introduce themselves in just a moment. And want to thank all of the partners that came together to bring these events to you. And just to let you know, there are previously recorded events on the Lawrence Public Library website, so you can go and view those if maybe you've missed some of the other sessions that have been in this series. So once again, you can go to Lawrence Public Library and look at the Before You Check Out Lunch and Learn About Death, and you'll see a variety of different topics. You can watch those previously recorded sessions. So thank you, of course, to the Lawrence Public Library, also to the Visiting Nurses Association, Midland Care, and LMH Health for coming together to bring you a variety of speakers. So that being said, I'm going to turn it over to our panelists who can introduce themselves and just tell us a little bit about your background so that people can get an idea of questions they might want to ask. So Larry, if we could, we will start with you, please, if you could introduce yourself.
I'm Larry Dixon, and I have volunteered with Midland Care since 2012. Yes, and one of the things I have done is I have taken a person on errands. I did this for about 8 years with the same person. This person actually passed away several months ago. But another thing I've done is participate in, with family and with someone who is, quote, actively dying. And I have also helped with a grief and bereavement group. So this is what I do after retirement. And previous to that, I started out being a teacher, taught German and English in high schools, and also did retail managing after that. So yes, I'm glad to be here today and to be with you and to be available to answer some questions if persons would have questions too.
Great, thank you so much, Larry. Melinda, would you like to introduce yourself, please?
My name is Melinda Reyes, and I am a social worker with Visiting Nurses Hospice. So I have been with VNA Hospice for a little over 2 years now. And I also work part-time at LMH Health. So really, a lot of my experience comes from patients and families who are on service with us for the hospice program.
Okay, great, thank you. And Robin, if you could introduce yourself, please.
Sure, I'm Robin Colerick-Shinkle, and I am the chaplain over at LMH Health. I've been here a little over a year and a half, going on 2 years. My background is in ministry. I've been a church pastor for a number of years. I also served as the chaplain out in Wichita at St. Francis Hospital and down in Texas. I've done hospice chaplaincy, I've done bereavement care with hospice, and I currently help with the bereavement here at LMH Health. So I'm glad to be here today.
Okay. Thank you. Thank you very much. Okay, well, welcome to all of our panelists. We do have some questions that have come in, and if additional questions from any of our participants, you can kind of toggle over the bottom of your screen. There is a Q&A section, and you can answer, or you can ask your questions there, and we will relay those to our panelists. So with that, I would like to go ahead and just kind of open it up to this first question that came in, and whoever kind of wants to jump on this from our panel, that would be great. But what is something that you should not say to a friend who is grieving? Is there any comments that are off limits? Looks like Larry maybe was going to take this one. He put up his hand.
Don't say that to someone who is grieving. Don't say, okay, this person who passed away is now in a better place. This would not be comforting at all to someone who is grieving, and would probably only make the grief more,
A little more intense. Okay. Okay. Melinda or Robin, would you like to add to that question? Any answers or anything?
Sure.
Something not to say to
Sure,
a
I
friend.
agree. Definitely. Yeah, definitely. I agree with what Larry said. To say they're in a better place, because most bereaved people think the better place is with them, and we want our loved ones with us. I always kind of try to steer away from cliches. So any of those, it's God's will, better place, God needed an angel. We have a lot of kind of things that we say. If it comes quickly or it's a cliche, I always kind of steer away from those, and try to think about how we would feel if we were in that situation when we've lost loved ones. So that's kind of where I would agree with, is definitely, you'll get over it. You'll, everything will be back to normal. Those kinds of things are not very helpful and can be actually very hurtful.
Thank you. What about the alternative to that question? What is something that you should say? What is a really great thing to open up with a friend who is grieving?
I would say, tell me about how you're doing, how you're feeling right now, and encourage the person to talk about the person who has passed away.
I would agree with that. I think a lot of times when we follow up with individuals, who are in the grieving process, just coming from a really non-judgmental standpoint, and also, just doing a lot of listening and validating people's feelings. And like Robin said, avoid cliches, even though sometimes it's very tempting to let those things slip. But I have found that just doing a lot of listening from a non-judgmental place and validating feelings has been very helpful.
And I think the only thing I would add is let them know you care. What if you don't know what to say, just let them know that you care about them and that you love them, and go from there.
Okay. Thank you all. This question was, should we talk about the person who has passed away, or should we avoid discussing them? What are your recommendations? Oh, did I lose you guys?
I think it's always good to talk. And so I think they're frozen on my side.
Well, I can hear you, Robin, so I'm going to let you take this
Can you?
question.
Oh.
Yep,
Okay,
I'll
I was gonna say
repeat
they're
that.
frozen on me, but
So should we talk about the person who has passed away, or should we avoid talking about them? What's kind of the recommendation there?
well, my recommendation is to talk about them as much as the person wants to. When I have worked with people who have lost someone, they often feel or have expressed to me that they feel like life goes on and people have forgotten about their loved one. And so I think it's important to let them know that we haven't forgotten them. And, you know, as much as they want to talk about them, that we want to listen and we want to hear, because they're still present, just in a different way.
Mhm. So you're saying definitely we want to bring them up, unless maybe the person tells us no thanks.
Yeah,
I would
unless
agree.
the person doesn't want to.
Okay. Okay. I like that concept of they're still there. It's just in a different way. So finding that way to still have those conversations. On this one, I'll just kind of open this up to the group again. This is really about kind of the differences or similarities of mourning and grief, and how can you differentiate between those, and how do we help people with both of those, grief and mourning?
I would be glad to start with that. And I looked at a book here by Dr. Alan Woolfelt, and there is a very nice description of these two. Grief is the internal suffering caused by the death of a loved one, and mourning is the outward expression of grief and bereavement. In other words, he says, grief gone public. So, yes, I thought those were wonderful definitions of those two words, grief and mourning.
Yeah, those are
And
definitely
yeah,
helpful.
I
That's
agree. I love
great.
that book. Yeah, that's a great book. I love that book too. And,
Can you tell
you
it?
know, anything that pulls the emotion out. Sorry?
Mhm.
On that note, when you talked about the book that both of you seem to be familiar with, that, are there other books or resources that might be helpful to families? Anything that you have in mind, and we can share those out as a resource. But are there things that would be helpful, specifically if we could recap the name of that book, but then other ones that maybe pop into your head as excellent resources?
I'm going to let one of the others respond to that.
Well, I do use that book when I do grief support groups. It's Understanding Your Grief by Dr. Alan Woolfelt, the 10 Essential Touchstones. And those 10 touchstones are wonderful. There's also a companion journal that goes with that. That's very helpful. Pretty much anything by Dr. Woolfelt I have found to be very, very good, very helpful. Um, there's there's some hospice books, like one called Final Gifts, that I think is really nice. Uh, there's several resources for kids that I've seen hospice put out, like a coloring book. And there's a lot of really great resources. But yeah, I use that book a lot, where I start.
We also use Alan Woolfelt for our bereavement groups, and just to refer the individuals to who are wanting to, I guess, have something more concrete to understand what they're going through. And then we also use a a book called Gone From My Sight. It's, just a brief description of some of the physiological changes that may take place during the dying process. And then we did start a program called the Keepsake Program with our hospice group. And we have been giving out materials for children who are going through grief. So there are, various books and activities depending on the child's age that we also utilize for bereavement.
I would add to that Midland has had a camp that has been, I think, given for a weekend, and children who are grieving have been invited to that. And from what I have heard, I haven't participated with it as someone helping, but I have heard that it has been really very, very helpful for these children.
I would agree with that, Larry. We have referred children and families to that camp, and they have had nothing but wonderful things to say.
Thank you.
Are there additional resources such as these camps, like a camp that you're talking about, or when, if the family wanted to reach out, or an individual to maybe join a group? Are there groups or things that people could connect to find these resources, or even just to find a support group?
We offer a group called Life After Loss. And so we do that. We try to do that 4 times a year. It looks a little different now because of COVID. So we haven't had a chance to explore our virtual options for that. We just did a group called Healing Through the Holidays. And so that was done through Zoom. And we had our chaplain and our other social worker facilitate that group. And that is something that we do offer every year. So those are some resources that we try to get out to people, and it's open to the community. So, anybody could utilize that resource through us.
We also have grief support group. Those are led by me here at the hospital. We've been doing them this year on Zoom as well, and it's worked incredibly well, far better than I was anticipating. So that's been very helpful. We also are planning 4 sessions for 2021, and they are 12 weeks long. And we go through that book by Dr. Woolfelt and go through some other things. But yeah, I'm always happy to hand out resources, always happy to talk to anybody if they call up to the hospital and try to help. And we definitely have group to help.
I would add to that I certainly second what you're saying, Robin. And when I was working with a grief and bereavement group as a helper, I found that the people who came newly having lost a loved one, those persons were, oh my goodness, they were not in the best of shape emotionally, as one would expect. But with time and encouragement from others, from the leader and anybody else, then I found that they were able eventually to be encouraging, and they developed friendships with the other persons in the group, and they were helpful in ways that one would not even anticipate from the very beginning. So, and I would say too that I am still in contact with some of those persons, a few of them, and they reach out to me, and I try to reach out to them. That has just been a wonderful experience for anybody who has been participating.
Yeah, it's amazing.
Excellent.
Some of
Um,
the groups that we've had this year, they're continuing on even after the formal group has ended. They continue on because they've made such strong friendships and have such a bond in the group. So it really is a wonderful support.
so then possibly as a friend to someone who's grieving is maybe trying just to connect them with the variety of groups in town that have support groups so that they can really make those connections. We should maybe try that. What are some other things that a friend could do to kind of help someone as being their support system? We jokingly called this more than a casserole, but is a casserole okay? And what else? What are some of the initial helpful things that we can do for someone who is grieving?
Well, I think a casserole is perfectly fine. Sometimes people need food. Initially, when someone loses a loved one, there's family, there's a lot of preparations. They're not maybe thinking in the same way they normally do. And so having a meal for them is a wonderful start. Being there to help with the basic things that sometimes we don't think about, helping with family coming into town, helping make those arrangements, helping take care of pets, those kinds of things that we don't think too much about. Being there just to support them. We always tend to say, call me if you need anything, and rarely do people call, at least in my experience. And so sometimes it's good to just say, I'm bringing you dinner tonight, or I'm going to be there at 3 o'clock to help you clean house. What can we do? And try to be there to let them know that you're there to support them.
Our congregation has a meal train, and this isn't specifically for those who have lost someone through death, but when there is a need, when there is any kind of need, then persons can volunteer to provide a meal. And sometimes my wife has noticed that if there's the meal train that's on, she needs to respond almost immediately, because there are others who quickly respond, and she doesn't get to provide something right away, although farther down the line, that possibility exists for her. So I think that could be arranged.
And just to kind of add to the wonderful things that you guys are bringing up, and I know I had mentioned this before, but just listening and really validating what this person is going through. I have heard from a lot of people who are going through the initial shock of a loss that has been just very beneficial. Just someone there just to talk, just to listen to what they're saying, and and not offer any advice or really it's just beneficial for them to be heard. So I just wanted to add that piece as well.
I would like to validate what you just said, Melinda.
On that note, how often should someone reach out? I mean, I love the idea of saying, okay, I'm going to be there to help, and here's when I'm going to be here. How often do you feel like people should reach out to help those who might be grieving?
I would say that it depends on how the person responds, who is the person grieving, and probably with some degree of sensitivity toward that. If somebody tries to push that person away who is offering help, then maybe not as often. But if another person, if someone is grieving and the person is somewhat shy about asking for any help, maybe maybe now and then a little more often. What do others think?
I think that listening piece is important, what you're saying, that intuitive instinct, if they're kind of pushing away, or you might draw back and not be there, but if they're appreciating it, then they're welcoming you. So I think kind of just paying attention and listening to how they are, and what they say and how they receive you.
Thank you, Robin.
Would someone from the panel be willing to talk a little bit about anticipatory grief as the holidays are coming up, and that can mean a variety of things for individuals. So what are some things that we can do to really help a friend through that anticipatory grief?
Well, anticipatory grief is, grief when you know something's going to happen, and you know that a loved one is going to die. So you begin grieving before that has happened. Or it's also, like you said, anticipating holidays, special days, birthdays, um, the Memorial Days, days that were special or important, anniversaries. And so, I guess what I would think is I think it's helpful to have a plan. So we know that Thanksgiving is coming up, and maybe this is the first Thanksgiving or the first Christmas without um, our loved one. And so we kind of come up with a plan to have something to do that day, rather than letting it just bring up on you, and our loved ones find out, oh, this is Christmas, and might not have anything to do anymore. But maybe talk to them about special traditions, talk to them about what they might want to do this year, and have a plan for the day to help them through it.
And just to add to what Robin is saying, I know there a lot of times the people that we have on hospice who know that they may not be here for the next holiday do find ways to make this year special. And like you're saying, Robin, come up with some special traditions and ways that they will be remembered for the following holidays to come. So we see that a lot, especially this time of year. And unfortunately, with the pandemic, people have been getting more and more creative and making those things, I guess, even more important.
So Robin, you were kind of addressing that second aspect of anticipatory grief. So is that maybe when, or maybe like Melinda indicated, if someone's on hospice and they're thinking about the possibility of it being their last. So are there other ways to kind of handle that anticipatory that isn't necessarily related to a date or something that would trigger a memory, but just realizing that maybe you are at the end of life, and kind of that grief that already is beginning before the true end.
And I think, being available to talk if they want to. Some people want to talk about dying. They want to talk about funeral plannings. I have planned with people who are dying their entire service, and they've written their own obituary, and they want to be part of that and help. That's part of that process. for them. And I've also met people who don't want to do that. So I think part of the anticipatory grief is seeing what they would like to do, seeing what they want to talk about, maybe even naming what's on everybody's mind, that maybe their loved one isn't going to be alive even this Christmas, um, you know, and talking about those kinds of things, addressing it and seeing where they want to go, or maybe they'd like us to do something in their honor. Um, being available to be somebody that they can talk to, cry with, and be honest and real with.
Excellent. There was a question that came in, and it might be related to this, or you all might have something to add, but someone had said, I have a friend who is 20 plus years younger than I, with teenagers, who has received a terminal diagnosis. It may be several years and she's functioning now, but do you have any tips on talking with her on a regular basis?
You know, I think letting her know you're there on the journey, and having teenagers, having those conversations, it doesn't have to happen right away, but opening the door to, what do you want them to know, what do you want them to remember, what do you want for them, and trying to walk with the friend, the journey, that you're there with them to go through this, because I can't imagine leaving teenagers and what you would want for them, and being there as things come about, and being there for the teenagers too.
I think that would be very helpful. I commend you for the response that you gave, Robin. I might say that when I was 9 and 10, I lost both parents. And there wasn't such a thing as a grief and bereavement group. And that was hard, although I had friends, but my relatives took me from the state where I was living to a different state. And there I spent time with the first set of relatives to finish the school year. And then they took me to another set of relatives, and I spent the first part of the summer with them. And then they took me to yet another set. And at the end of the summer, they called the family together, all the uncles and aunts, to ask, okay, who wants to take him now? And if there had been some kind of plan for me, it would have been easier, actually. So I guess on the basis of my own personal experiences, I really say that having some kind of plan that the person can know and expect what might happen next might be helpful.
I agree with both of you. We have had some folks on with young children and teenagers, and it has been very beneficial just all the way around, just to have a plan, and just to have the kids have some kind of understanding of what's going on and what they can expect next has been very helpful.
Great. Thank you all for that. I would say we would definitely leave all of the emotional aspects of that up to you. I do want to just let everyone know, on the first of our series in this was on a lot of documents and things that might be helpful in this situation. Just kind of, yes, let's have a plan, but some of the legal aspects that might go with a plan. So one of our first sessions would have some resources on that if anyone is wanting information on that. Please absolutely keep your questions coming in. Again, near the bottom of your screen, you can toggle over that and the Q&A will pop up. So please keep those coming. We'll keep asking. I'm going to switch just a little bit here to some questions from a person who might be experiencing loss. So if a person is experiencing the loss, what will I do when I don't have to care for a loved one anymore? So again, they're in that process now where they're doing everything that they can for that person who either is having a health issue or a variety of needs. But how can we help them to get ready so that when that person is gone, what they can do, how they can attempt to move on?
I don't know if you could ever really help them be ready for it. Even when we know someone's gonna die, we just never are really ready. You know, the journey of grief is going from what is normal, so being a caregiver, to what is a new normal. And a lot of times that involves creating new identity, finding new purpose, reevaluating priorities, reevaluating what's who you are now and what you do. And that's part of that work, that grief work. Dr. Woolfelt calls it often soul work, because it's part of just who we are. There's a transformation from being a caregiver, and that's what we do, and that's our purpose, and that's our calling, and that's what we want to do for our loved ones, to having them not here anymore and going through that journey of what life looks like now.
I would add to that the necessity of the caregiver taking care of oneself physically and emotionally and spiritually and every other way in order to move on in the journey. And sometimes I think that can be difficult because of the need to switch roles from being the caregiver to then continuing to whatever comes next.
I would also add, how important that self-care piece is. When working with families who know that there's anticipatory grief, part of our roles as the social workers on our team, we really try to encourage caregivers to practice self-care so that they can continue the caregiving, but not only for that, but, even when they're out of the role of the caregiver, it would be just beneficial for them to continue that practice regardless. So yeah, I agree with both Larry and Robin, and just experiencing that journey and taking care of yourself.
I appreciate all of those answers. That was one of the questions that had come up was, is it okay to take time for myself when I'm a caregiver? And I think you have all commented that it's more than okay. It's absolutely necessary. So that was great. Thank you. Another question that has come in is, what if I can't say goodbye? So I think previously we've talked a lot about, maybe having those last moments with somebody or being able to plan and know that this is a distinct possibility. But what if there isn't time to say goodbye? What do you recommend for those people?
I would say that many times the person who loses a loved one can feel a bit of guilt. Oh, I didn't do enough. If I had just done this or that or something else, maybe we could have saved the person's life. So for sure, connecting with someone who can be an empathetic listener, and I'm talking about somebody with a professional standing, a counselor, a minister, someone who has skills in helping this person to get over, get through the grief process, would be what I'd recommend.
Unfortunately, here at the hospital, we have some deaths that are not at all planned, especially like in the emergency room where people really don't have a chance to say goodbye. Maybe the person wasn't even sick to their knowledge. I think that ritual and tradition, even funeral services, those kinds of things can help offer some of those closure opportunities. And so even if you don't get to personally say goodbye and have that moment where you can do that, to find a way to do that, whether it's through something that you did with that person or shared with that person, a ritual, a tradition during a service, something to where you can have that opportunity to say goodbye to them in a different way.
Excellent. Thank you. Thank you. So I just want to remind everyone, if you do have any questions, you can put those in the chat. If we could, with the panelists, if maybe we could go around and let you tell us any of the things that maybe you haven't been able to cover yet today, or any advice, any resources, anything that you would want to share that maybe we haven't asked about. And then we'll open it up one more time for questions. But if anyone wants to lead us off on last minute things that you want us to know.
I would just say to reach out to those supports and resources. We're definitely out there, and even though it is a struggle and a challenge amidst the COVID pandemic, there have been some new and creative ways to provide that support. So, if you are someone who's struggling, or someone who may be struggling with grief or loss, definitely utilize those supports in the community and within your natural supports as well.
Definitely. And I would say, if you are helping someone who's grieving, if you're a friend, allow them to grieve. Give them safe space to be where they are without judgment, as Melinda said. And recognize, if you are a friend or if you are grieving, that it's a process. There's no linear timeline. It's not just that old phrase, time heals all wounds. It's work. It's hard. And culturally, we sort of expect people to get over it, quote unquote, within a few months, and to get back to themselves, or maybe even a year. But grief is a lifelong process, and just to be a friend on the journey, and know that it's okay to take time to take care of yourself.
I would add that we don't get over it, we get through it. And I certainly
Excellent.
agree with what both of you have said, Linda and Robin.
Great. Thank you. Thank you so much. That was excellent, excellent information. Let me just double check. There might be another section here. Make sure I got all of these. Oh, there are two more questions that I'm gonna ask out to the panel. So for terminal illness parent situation, if I had a friend have their terminal friend make videos for their children to be shared at specific life events in the future, like graduation, wedding, first child. Do you know of any companies like that in Lawrence or any resources like that?
Unfortunately, I don't know of any, but that would be a great idea and resource for, if that person were to find resources for that, that'd be great to share, because that sounds really awesome.
That does sound great. Yeah.
I
And then
agree.
a final, oh, go ahead, Larry, sorry.
No, I just say I agree, but I don't have resources to suggest.
And then one other question was, the resources that were shared, are those Christian-based or are they non-denominational? So some of those books that were brought up near the beginning of the presentation.
Understanding Your Grief is not a Christian book. It's not a Christian based resource. He does call into our spiritual dimension, because that is a big part of who we are as people. And grief definitely affects that, but he does not come from any religious background that he promotes.
Okay, excellent, thank you. Okay, any last questions from any of our participants? Anything? You have an excellent, excellent panel here, and I would love for you to be able to ask them some questions if there's anything on your mind. Okay. All right. Well, with that, I just absolutely want to thank our panel again for your time, for your expertise. Thank you so much to each of you. We very, very much appreciated your perspective and the wonderful information that you shared. So thank you for giving of yourselves to us. We appreciate that. And thank you again to all of the organizations that have partnered to bring you this series. So thank you again to Lawrence Public Library, Visiting Nurses Association, Midland Care, and LMH Health. And just as a reminder, this is still being recorded and will be on the Lawrence Public Library website, as well as the others in this series. So thank you all again so much for joining us, and have a great rest of your day. So thank you.
Thank you.
Thank
Thank
you.
you.